When he said you have diabetes, I didn't get terribly upset because I didn't feel any different.
I'm trying to manage the diabetes, not the diabetes manage me.
This is a disease. It's not going to go away. But with good management, good physicians, you can have a healthy life.
Major funding for My Health Counts provided by Blue Cross Blue Shield of Western New York and by the New York State Department of Health. Produced in partnership with the P2 Collaborative of Western New York.
I'm Susan Hunt, and today we're going to talk about diabetes. It's estimated that 80 million people in the United States have diabetes or are on the verge of developing it. About 6 million people with type 2 diabetes don't even know they have it yet. It's a serious, lifelong condition, but there's a lot you can do to protect your health. You can live well with diabetes.
We're all at risk. It's the epidemic of the modern age.
Okay, 1, 2, 3.
There are certain days that I wonder if I did a family medicine residency only to become an endocrinologist. People are sometimes shocked and surprised when you tell them that their sugars are elevated and that they have diabetes. They won't sometimes believe you. There's a multitude of organ disease that goes on with diabetes, and it's not as simple as treating the sugar. We have to be very aggressive with treating pretty much the entire body, focusing on the eyes, the kidneys, the heart. I think it's important to educate folks, and that can be partially through their healthcare provider. It can also be through a nurse, such as a clinical care coordinator that we have in our office.
The thing that affects your blood sugars the most are sugars itself or the carbohydrates. That's what makes your blood sugars high.
And also through diabetic education, where you see a certified diabetic educator, nutritionist. We encourage our folks to go to the classes, learn as much as they can.
The best time to exercise when you have diabetes is an hour to an hour and a half after a meal.
The patients that always do the best, the patients that have the least complications, the least visits to the hospital, the least visits to the ER, are the people that buy into the idea that I'm only part of this process. I mean, I'm sort of the quarterback, I guess. I call the plays, but I'm going to give you the ball and see where you're going to run with it.
I'm type 1 diabetic. It just happened out of nowhere. Well, it started with blurred vision. I also had, at the time, the classic diabetes symptoms of increased urination and thirst.
He always has watched his diet. He always has remained physically active and in great shape. And Kevin, unfortunately, developed diabetes just because of rotten luck.
All of a sudden, my pancreas abruptly stopped, and I was overwhelmed for the first 48 hours, totally overwhelmed with everything I had to do. It was kind of like a crash course all at once. I didn't even know what insulin was. I had no conception of sugar levels. I had some past experience with friends, one of whom passed away that had diabetes, and I immediately recognized the fact that I had to get control of this disease, that I could not let this disease control me. I'm checking myself 4 times a day.
No kidding.
I'm sitting on every piece of food that I digest. I know exactly what that's doing to my sugar level. So I had changed my diet around from being carbohydrate-based to protein-based, and with a lot of complex carbohydrates with fruits and vegetables. I found that physical activity would drive my sugar levels down. It is so routine for me at this point, I don't even think about it anymore. My wife, Joanne, she's been right there for me, my mainstay on the home front.
Now look at your number. It's outstanding. That's impressive.
I know that Dr. Dillamarter and Ann are just a phone call away. They've always been there for me.
Yeah. I really need you to see the eye doc, and they give you the drops, and they open your eye up, and they've got their machines to be able to look in the back of the eye to tell if there's any damage at all from the diabetes. And typically we have you do that at least once a year.
Don't pretend like it's something that the doctor is going to fix for you. It's a very controllable disease. It should have minimal impact on your lifestyle if you just pay attention.
I'm joined by Dr. Donald Robinson and certified diabetes educator and registered dietitian Pam Beamer to talk about diabetes. Both of you, welcome. I'm delighted you're here, and we could probably spend the next 3 hours talking about this disease, so we have a lot to cover, so let's dive in. Doctor, I'm going to start with you. You know, diabetes, in the simplest form, let's define it. What is diabetes?
Well, diabetics have trouble absorbing food, turning it into fuel, and pushing it into their cells. The fuel, as glucose, stays in their bloodstream, and they get very high blood sugar levels, which causes problems. Meanwhile, the rest of the body starves for sugar, and you get weaker and weaker.
And insulin is the key, isn't it?
Yes, you need insulin to push sugar or glucose from the bloodstream into the other cells. And if the insulin isn't there, as in type 1 diabetes, or if it doesn't work right, as in type 2, either way, you get high blood sugars and not enough fuel to the rest of the body.
I want to just step back for a second because I want to make sure I understand this, okay? We've heard that, the body needs food for fuel. So I take my food in, all right? Now, once it's there, the only way that food can then be translated into energy is having insulin. So you mentioned that, type 1 diabetes, often known as juvenile diabetes.
Right.
So that's where you have no insulin whatsoever.
Type 1 diabetes is when the body stops producing insulin altogether. Mm-hmm. It comes on very suddenly, very often triggered by a virus. Mm-hmm. The only treatment for type 1 diabetes is insulin via injection or insulin pump.
And then type 2 diabetes?
Well, type 2 is where there is insulin present, but it may not be enough, or that insulin is not very effective. So either way, that sugar is stuck in the blood. Type 2 is the more common type of diabetes. 90 to 95% of people with diabetes have type 2.
And I've heard this term pre-diabetic. What does that mean?
Prediabetes means the sugar's a little high, but not above 125, somewhere between 100 and 125. And unfortunately, prediabetes leads into diabetes, and gradually your sugar goes higher until eventually become a real diabetic. On the other hand, if we can find prediabetics, put them on a good program of diet, weight loss, and exercise, we can keep that from happening.
Okay, so what's the bad diabetes? Which kind is the really bad one?
The worst type of diabetes is uncontrolled diabetes. So no matter which type, whether it's type 1 diabetes or type 2, no matter how it's controlled via, be it insulin or pills or diet and exercise or a combination of those things, the best type of diabetes is well-controlled diabetes, and the worst type of diabetes is uncontrolled diabetes.
Let's talk about risk factors, doctor.
Being overweight, under-exercised are really big risk factors, but so is genetics. It runs in families, and certain races, particularly African-American, Native American, Asian, and Latinos are more at risk.
How do you know that you have diabetes or you're pre-diabetic?
Symptoms of diabetes include increased urination, increased thirst, and fatigue. Those are the big three. Also, blurred vision is a symptom as well.
If I came to you, doctor, and I said, I'm thirsty, I go to the bathroom a lot, would you presume that it's diabetes?
I would certainly want to test you, and it's easy to do. It just takes a drop of blood. Most of the time, we know within 30 seconds if you're diabetic or not. Sometimes we have to do more careful tests, but they're easy to do.
All right, so you've given me the diagnosis that I am a diabetic, but I don't feel any different. I feel perfectly fine. But from what I understand, it isn't the disease that could kill you. It's the complications. And we're talking about really serious complications. Let's talk about a few of those.
Well, heart attack, stroke. Diabetics have a 20% chance of having a heart attack every 10 years. And it's the #1 cause of blindness. It's the #1 cause of kidney failure. Any vital organ can be affected by diabetes.
This is a really scary statistic. But today, 200 people will go through amputation. 55 people will go blind today. And that's because of not managing their diabetes?
Right. It's because of uncontrolled diabetes.
Wow. Well, you ought to know because you are a diabetic and you've been living well with it for how many years?
33.
I think that's the key here, is that if you've been diagnosed, that's okay, it's done. You have diabetes. But the next thing is being proactive, becoming a very vital part of your future by taking it seriously and managing it early.
Dr. Delamarter was telling me I had diabetes, and it just wasn't registering. And then my wife started asking me, "Are you listening to what he's telling you?" You know, I said, "Yeah, I'm borderline diabetic." You know, I said, so to me that means I don't have it yet.
Eventually, his sugar levels got to a point where it was very clear that he was no longer pre-diabetic, but that he was officially diabetic.
He said to me, "I can't help you unless you help me to help you." And I said, whoa, you know, and it was so serious, and just the look on his face told me, you know, you're a diabetic and you really need to do this. He gave me a lot of things to do. It was so many things, and I almost felt overwhelmed.
I like having an impact on your health care, but it's not as easy as me writing a bunch of scripts and sending you on your way. You know, I need your help. I need you to work on your diet. I need you to exercise, which I guess you're doing too.
He brought his wife in. He was scared. He knew he let his diabetes go for such a long time, knew very little about nutrition. So if you're at a strange restaurant, just say, do you have your carb list for me? And they can provide that for you.
I'm an eater. I loves to eat, and I have excellent, great cooks in the family, and you know that one was tough.
It's nice though that the light has come on and you are taking charge, and you've done some pretty amazing things here in the last few months. You've managed to stop smoking, I think, and hopefully you're not smoking now, right?
No. I'm trying to manage the diabetes, not the diabetes manage me.
It took a while, but now he's plugged in and he is taking charge.
If I had understood that borderline diabetes meant I had it, I would have done something way back then. Pay attention. Your diabetes, ask the questions. Start asking the questions right then. And especially us men, start asking the question.
Being diagnosed as a diabetic can be pretty darn scary, and I would have to say pretty overwhelming, because this isn't something that you just fix on the spot and call it a day. It's the rest of your life. So I think that the key here that I'd like to kind of start with is that you're not alone, that you have a team of people that you can assemble and will be your team for as long as you manage this disease, starting with your primary physician. And,
Yes.
and the neat thing is the two of you are a team as well, right?
We work together. We see patients back to back, so that after Pam sees a patient, I'll see them as well.
I think education is the key, really, sitting down with the various people on your team, and that includes diabetes educators and going to a diabetes education class and learning how to fit diabetes into your life and how to make it realistic for you as the person with diabetes.
But there are lots of other people that add to the team. Eye doctors, foot doctors, perhaps a gym trainer, because exercise is really important. And occasionally you'll need a specialist, an endocrinologist or a cardiologist. They can all help.
All right, let's talk about behaviors now, and let's start with the first one that seems an obvious, which is managing your diet. I hate that word diet, Pam.
Me too.
I know. How much do you have to cut out of your life? Is it going to be really painful?
No, it doesn't have to be. And this is where a registered dietitian and a certified diabetes educator can really help. It really, what it comes down to is balanced, healthy eating. And the way a person with diabetes eats is the way the entire population should be eating, in that, you know, the appropriate amount of calories. And if we saw more people eat that way, we would see less diabetes to begin with.
How about being active? Now, doctor, the obvious thing is that will help you lose weight, but there are other benefits to being active?
30 minutes of exercise a day will increase your insulin sensitivity. So if you don't have enough insulin, or if it's not working well, it'll make it work better.
So when we talk about losing weight, does that mean you have to lose 30, 40 pounds? Is that what you're looking for?
As little as a 5 to 10% weight loss can make a big difference in your blood sugar as well as your blood pressure.
The word monitoring always comes up, and that's a little confusing to me. Can you kind of help me understand that? What am I monitoring and how often?
Well, first thing to monitor is your sugar. We like all of our patients to have glucometers and to use them twice a day, every other day, because just checking your sugar once a day, say before you eat, doesn't tell you much about how high it goes after you eat. And by using your meter, you can figure out what you can eat safely and what's going to cause you a problem.
Are there specific numbers, a range that we should be looking for?
Yes, fasting between 70 and 150. After a meal as high as 180 is still okay.
Okay, and again, keeping a chart of this is probably a really smart idea, isn't it?
Yeah, the meters will record the number and keep them in memory nowadays, but it's also a good idea to write them down on a chart, because then you can see if they're going up or down, what the trend is.
And medication is usually part of treating any chronic disease, but I know a lot of people, they'll say, oh yeah, I take medication, but they don't do it as prescribed, and that's key, isn't it?
It is, and the easy way to keep people honest and make sure they take it is have them check it off on a calendar or write it down in a book when they do take each pill.
Pam, as an educator, I'm sure that you hear a lot of patients come in and they get discouraged. They face roadblocks, and at this point you've got to kind of help them solve these problems. Am I right?
It's about taking their personal lives, their schedules, their family situations, and seeing how we can best manage their diabetes within those realities. But managing stress is key, and coping with stress is key, because stress can impact the blood sugar.
Doctor, reducing risks. Give me a blueprint. What can we do to reduce them?
Well, we can eat right, exercise, stop smoking, check your feet once a day for numbness or any sign of infection. Diabetics develop peripheral neuropathy, and it can sneak up on you. You can get numbness in your fingers, your toes, tingling, or even some pain. And you can easily get an infection because you can't feel things. So checking your feet once a day helps.
Well, diabetes is a tricky disease to really manage, but clearly with a team in place and, not allowing yourself to become overwhelmed, I think you can come up with a very strong plan that you can put into play for the rest of your life.
I was pre-diabetic for about a year now. We've been watching it. That's when we started coming to some of the classes.
We have whole wheat pizza with asparagus and feta, spicy beans and greens, buttery lemon shrimp, and tart and tangy cherry salad. For diabetes, it really is about overall healthy cooking.
When he said you have diabetes, I knew it was serious. I knew it was an illness, and it's something you'll probably have the rest of your life, but I didn't get terribly upset because I didn't feel any different. I figured, well, I really have it now. I'm going to be on medication. I'm going to have to make some changes, but I've dieted on and off all my life, and I wasn't going to change anything very drastically.
We know that with diabetes, you should be having whole grains. Whole grains help blunt the effect of on the blood sugar of the carbohydrates, so they're absorbed more slowly.
Started coming with a girlfriend, and the two of us are both overweight. She's diabetic, so am I. We've just made gradual changes. We've learned a lot of little hints from Pam, like the whole wheat flour. I don't buy the white flour anymore.
And we're going to use a little bit of Splenda, some sugar substitute here.
Yeah, we got a lot of great recipes. We all talk. We discuss some of our problems. It's a lot of fun. I love to bake. I love to cook. And that part's been an adjustment.
Your life does not have to be turned upside down because of diabetes. And that's really the point, is that you can make small changes within your lifestyle and really at your pace that will make a big difference down the road.
This really is an awful lot to think about, from dieting to exercise and testing and all of that. But what it boils down to is you've got a team and you should be using them. And it's a two-way street, isn't it, Doctor?
Yeah, there's a lot that a patient can do to make my visit with them go more smoothly. They can bring somebody with them to take notes and to have a second ear. They can keep a notebook. Doesn't have to be fancy. I like 3-ring notebooks, but a manila folder will do fine. Just throw everything in there, ask for the results of our lab tests, and ask what the numbers mean. If we say, well, your sugar is good, then say how good and what should it be.
And Pam, you're there to help interpret a lot of these results and help people understand the numbers along the way.
Right. So I reinforce what their goals are, and I also reinforce where they stand at the current time. And so again, we're just presenting that same message, maybe said in a slightly different way, but the message is your diabetes is serious, and it takes the whole team approach to help control it.
And in your case, you're in the same office, but that's not always the case. So I think that people need to know that if you have been diagnosed, and you don't have an educator in that office, you should still be seeking that information out.
Absolutely.
All right, well, we've got a blueprint in place, and in that blueprint there should be expectations once a year, every 3 to 6 months, that kind of thing. So let's talk about Dr. Every Visit. What would you be looking to do?
I want to check my patient's vital signs, like their blood pressure, look in their eyes, review their sugar log, check their heart and lungs, look at their fingers and toes if there's any numbness. The hemoglobin A1C should be less than 7, and the lipid panel, their HDL should be greater than 40. The LDL, the bad stuff, should be under 100.
And it is different than the average person's cholesterol, right? You're looking for different numbers.
That's
from
right. Diabetics are at greater risk of heart attack, so we want to keep their blood pressures lower, like 130 over 80. We want to keep their cholesterol lower as well.
And let me reinforce the reason for all this testing. As we mentioned earlier, with the disease comes the complications of amputation, blindness, kidney failure. So the tests that you're doing are really trying to stay on top of all of this. What about every year? What tests would you be looking to do once a year?
A formal eye exam, not just looking casually, but putting drops in the eyes and taking a really good look around, done by an eye doctor. That's a dilated retinal exam once a year. Checking for protein in your kidneys, which is a sign of impending kidney failure. That's a once-a-year test as well. And immunizations like flu shots, and once every 10 years a pneumonia shot.
And patients probably get, 15 to 20 minutes with you, and then with Pam, you spend more time. So you're probably able to sense, a lot of the frustrations and fears. You're a real support system, I would think.
Right. So it really is about making it real for them and making it work for them. And we love supportive families. That's a key, is to have that family support. So we really encourage the patient to make sure that their family's on board with them and to explain to them, this is what's needed, this is what I need to do.
And Pam, for people that are looking for additional support and resources, where should they turn?
The American Diabetes Association is a great resource, both locally and nationally. And they can refer you to local resources, but their website, which is national, has great information, great recipes. Also, the Center for Disease Control, or CDC, they have great information as well.
This has been an amazing discussion. First of all, I understand diabetes better than I ever have. But I also understand that as serious a disease as it is, it can be managed, and you can live well with diabetes. So thank you both very much. This has been great.
I've been diagnosed as a type 2 diabetic for about 20 years. There's a history in the family on both sides. My father was a diabetic, his mother, 3 of his brothers. My mother's side, my aunt and uncle. It's ironic because I am an RN, and I knew what to expect, and yet I was in denial. It scared me to bits. Unfortunately, I'm also a stressed foodaholic. Sometimes you sit there and you think, okay, a little pie, little cake, got away with it. Blood sugars are still good. And then it caught up with me. I have some neuropathy resulting from the times that I didn't really take care of myself as well as I should have. If you're touching my right foot, I can't feel it. I don't want to be blind. I don't want to have an amputation. I don't want to have kidney disease. The only way that I was going to prevent this was to stay with the diet, do everything that the doctor told me, and modify my lifestyle. So I decided that once and for all, this was going to be done. I went to Weight Watchers, I've been going for a year now. I've lost 100 pounds.
Your overall number is fantastic. I mean, I don't get many diabetics like this. Your hemoglobin A1C is 5.5. I mean,
The hemoglobin A1C, all my triglycerides, my cholesterol, everything is well within normal ranges. So it was a matter of taking care of Audrey. This is a disease. It's not going to go away. But with good management, good physicians, good control, you can lead a very successful life and you can have a healthy life. I have 3 grandchildren. To see them grow up, I will do anything that I have to.
Diabetes is a serious lifelong condition that doesn't go away. Yet you can control it with your actions, what you eat, physical activity, how you handle stress, and whether you take your medication and monitor your blood sugar levels. You have so much control if you take control. Diabetes is a wake-up call telling you to start doing things differently in your life. Now, you may find some of what you need to do is hard, but the alternative is far worse. Always remember that you're the most vital member of your healthcare team. Using the tips, suggestions, and strategies we've talked about today, you have the power to live well with diabetes, not only for today, but for the coming years. Take some time to visit our website and learn more. I'm Susan Hunt, and I thank you very much for watching.
Major funding for My Health Counts provided by Blue Cross Blue Shield of Western New York and by the New York State Department of Health. Produced in partnership with the P2 Collaborative of Western New York.